I've never actually come across a patient who enjoys taking their medications. In fact, most patients loathe the idea of having to take medications for the rest of their lives. So in today's video, I'm going to talk to you about how to approach your doctor regarding possibly getting off some, if not all, your medications. For those of you meeting me for the first time, I'm Dr. Amina Goodwin, a physician and health coach. I help you achieve ultimate health and vitality with simple lifestyle practices. All right, so let's dive into this issue of medications. A lot of people are over-medicated and at the same time feeling worse than before they started medication. So how do you approach your doctor about the possibility of getting off medications? This is something that I encourage everybody to do because a lot of people are on medications, and in not a few cases, some of these medications might not be necessary. Sometimes people get on medications, example, for reflux or a little inflammation in the stomach, and they end up staying on that acid suppressing medication forever. Sometimes people get a clot, they get started on a blood thinner, and somehow instead of being treated for 3 to 6 months with the blood thinner, they end up being on the blood thinner indefinitely. So to begin this conversation, I would suggest that you schedule an appointment with your doctor specifically to talk about this issue, because remember, doctor's visits are very short, and so you want to really make sure you reserve enough time to discuss this issue. Then take all the medications you have in your medicine bag to the doctor, including those that you might not be taking every day. Take everything to the doctor and lay them all out. And the first question is, Doc, which of these medications can I do without? Which of these medications are not absolutely necessary? Well, before that, you probably should just tell your doctor, look, Doc, I want to manage my health in the most conservative way possible. If I can do things, if I can help myself and my body without taking prescription drugs, that is what I would like. A lot of doctors actually like that. You see, a lot of patients kind of sometimes demand medications, but doctors actually enjoy it when patients want to not utilize medications for all their potential medical problems. All right, so tell your doctor first, you want to be conservative. How can you get yourself better without medications? And your doctor, knowing that you are on the more conservative side, would be more frank with you and say, okay, you know, this one, maybe you don't need this one, maybe you don't need that one. So just kind of lay everything out and then put to the side the ones that you really might not need. So start there. Now, your doctor might tell you, you know what, you need all these, like your pressure is high, your sugar is barely controlled, so you need all these medications. So then you can ask your doctor, okay, what can I do? What would you suggest that I do starting now so that I can, in maybe 3 to 6 months, get off some of these medications? And have a frank discussion with your doctor about diet and lifestyle changes that you can employ to get off medicines. Even medicines like the same acid lowering ones, you can alter how you eat. You can do things like not eating too late at night. You can prop yourself up in the bed, simple things like that, so that you're not having to take these acid lowering medications all the time. Another thing too is that a lot of medicines are to be taken when needed, but people end up just taking them every single day because it becomes a routine. So again, ask your doctor, okay, do I need to take this every single day, or can I just take it when needed? So that way you minimize the effect of chronic drug therapy on your body. So the doctor said you need to take them, and then you get an idea, okay, what can I do to get off some of them in 3 to 6 months? All right, and so you have that discussion. Now it might be, yes, you need to take all of them, but you can say, Doc, okay, can I reduce, are there any of these medications where I can reduce the dose? We do know that where pharmaceutical drugs are concerned, most of the effect is obtained with about 50% of the maximum dose. So when the dose goes above 50% of maximum, you're not getting much of a health benefit, but instead you might be more susceptible to side effects of the medication, or even severe complications. So you can look at all of them and say, Doc, well, do I need this high dose of this blood pressure pill? Can I potentially come down on this dose? Do I need such a high dose of this nerve pill? Can I come down on it? Muscle relaxants, all these things. Just look at them individually and see if you're not able to discontinue it, can you decrease the dose and therefore lessen the impact of possible side effects on your body, right? All right, so it might be, okay, yes, you still need several medicines, 3, 4, etc. So the next question you can ask is, which one of these come in fixed dose combinations. A lot of medications, diabetes medications, high blood pressure medications, they come as 2-in-1 pills. So you take 2 in a fixed dose combination, and what that does is it minimizes the pill burden. So a big thing with pills is just having a lot of patients who say that they get a bit upset with having all those pills sitting in their stomach, and so to minimize the pill burden, you can ask for fixed dose combinations. Now the thing about it is fixed dose combinations sometimes are more expensive than individual pills. So for financial reasons, people might end up taking 2 medications instead of just 1 pill. So these are some of the questions you can ask, but you are not going to get anything without asking. And you just need to be honest and frank with your doctor about these questions. I hope you all found this video helpful. Again, at the end of the day, you want to try as best as possible to have food be your medicine. No medicine is going to make you feel as good as making effective dietary changes. And when I say dietary changes, I mean optimizing your diet, your eating in a way that you're having more wholesome, unprocessed foods and much less factory processed packaged foods. Again, a pill is not going to make you feel as good as optimizing your diet. So ultimately, in addition to pharmaceutical drugs, you want to adopt a healthy diet and a healthy lifestyle in general. And in fact, you might have to take some medications for the rest of your life, but if you optimize your diet and lifestyle, that will actually help the medications to work better, and then also in the future have it so that you're not having to increase the doses of the medications. Once again, I hope you found this video helpful. Like it, share it. And if you want more, I'm hosting a challenge, the Eat More, Weigh Less Challenge, starting on Monday. There will be a link below for you to click it and check it out and register for this challenge if it makes sense to you. Have a good day.